What if the person you trusted most with your life, your doctor, was actually the one playing with it? Across the globe, desperate patients have been lured by promises of miracles, cures for cancer, hope for paralysis, answers to the incurable. But behind those promises, lies, greed, and a twisted hunger for power. From fake stem cell clinics to deadly detox retreats, these scams didn't just steal money. They preyed on hope itself. They offered salvation and delivered betrayal. In today's video, we'll uncover 6 of the most disturbing medical scams ever exposed. Real stories of manipulation, blind faith, and lives lost in the name of healing. Each one will leave you questioning, how far would someone go to fake a cure? And how far would you go to believe it? If you're the kind of person who believes that truth can be stranger and more terrifying than fiction, hit that subscribe button right now. Tap the bell so you never miss a story that pulls back the curtain on deception. And stay with us until the end, because case number 6 will haunt you long after the video ends. Now, back to the twisted world of false hope and real consequences. Case 1. The doctor who claimed he could cure cancer with baking soda. When patients heard about Dr. Tullio Simoncini, many believed they had finally found their miracle. An Italian oncologist who spoke with conviction and charisma, Simoncini, offered a theory that was as simple as it was seductive. Cancer, he claimed, was just a fungus, and it could be cured with nothing more than sodium bicarbonate. To a desperate patient, this sounded like hope. Real, tangible, affordable hope. Chemotherapy, radiation, painful surgeries? Forget it. All you needed was baking soda. Simoncini's theory spread like wildfire in alternative health circles. Videos featuring him went viral in the early days of YouTube. Holistic blogs echoed his message. Big Pharma was hiding the truth. The cure was already here. And Simoncini was the whistleblower. But behind the charm was something far more dangerous. Simoncini had already been expelled from Italy's medical registry for malpractice. He had no right to treat patients, yet he continued, presenting himself as a visionary, a martyr silenced by the establishment. In truth, he was experimenting on vulnerable people, bypassing every ethical standard of medicine. His treatments involved directly injecting sodium bicarbonate into tumors, the bloodstream, or body cavities. Patients reported severe pain, infections, and rapid deterioration. One woman, struggling with lung cancer, developed chemical pneumonia after an infusion. Another, suffering from liver cancer, experienced liver failure shortly after starting. His protocol. One of the most devastating cases involved a young woman named Lucia, diagnosed with breast cancer. Convinced by Simoncini's theory, she abandoned chemotherapy and flew to Rome. Her family begged her to reconsider. But hope is louder than fear, and Simoncini knew exactly how to sell it. She died just months later, in agony, and with no legal recourse. Simoncini never accepted responsibility. He claimed the system failed her, not his method. And he continued, even as lawsuits mounted. Eventually, he was sentenced to 5 years in prison for wrongful death and fraud. But by then, the damage was global. His lectures had been translated into multiple languages. Health forums cited him as a misunderstood genius. And even after his conviction, clinics inspired by his ideas opened across Europe and Latin America. What made Simoncini's scam so twisted wasn't just the lie. It was the psychological seduction. He didn't promise luxury or wealth. He promised life itself. And in doing so, he stole it. When someone sells you hope in exchange for your life, it's not just fraud. It's spiritual violence. Some say the worst kind of betrayal is the one that wears a white coat. But for Simoncini, the coat was never white. It was stained from the start. Case 2. The miracle stem cell therapy that left patients paralyzed. In the heart of Florida, a clinic promised something extraordinary. A regenerative treatment using stem cells that could reverse everything from arthritis to macular degeneration. It was called U.S. Stem Cell Clinic. And to those who were suffering, it sounded like science catching up to hope. The clinic operated under the guise of innovation. Patients paid upwards of $5,000 to participate in what they believed were advanced clinical trials. But there were no trials, no peer-reviewed studies, no oversight from the FDA, just aspiration bottled in syringes. and a heavy price tag. Stem cells, harvested from the patient's own fat tissue, were processed in the clinic and injected directly into problem areas: knees, hips, and in some cases, eyes. That's where things went catastrophically wrong. 3 women, all suffering from macular degeneration, were injected with stem cells directly into their eyes. Within days, they began losing vision. Within weeks, they were legally blind. One woman recalled waking up unable to see the outlines of her furniture. Another described excruciating eye pain, followed by total darkness. None of them had been properly informed about the risks. There were no clinical protocols, no backup plans, just vague reassurances and forms with fine print. Worse, the procedure wasn't free. Each woman had paid $5,000 out of pocket for the treatment, believing they were part of a revolutionary breakthrough. Instead, they became evidence in a medical disaster. When the FDA finally cracked down, they discovered a network of unregulated clinics across the country offering similar treatments. U.S. stem cell became the cautionary tale, but it was far from alone. The scandal shook the medical community. Ophthalmologists were horrified. Advocacy groups for the blind called for criminal charges, but the legal system moved slowly. The clinic claimed it had obtained patient consent and that complications were rare but possible. Patients had mortgaged homes to pay for the treatments. Some traveled from other states or even countries. Many had chronic conditions that traditional medicine couldn't cure. They came not because they were gullible, but because they were desperate. One of the victims, a retired librarian named Janet, said in court, "I wasn't looking for a miracle. I was looking for a chance. And now, I don't even get to see my grandchildren's faces." Investigations followed. The women sued. A federal judge eventually ruled that the company had violated safety laws. The clinic's license was revoked, and the FDA tightened regulations on similar procedures. But even today, stem cell clinics continue to operate in legal gray zones. A new website, a new name, a new promise. The cycle repeats. And for those living with chronic pain or fading vision, the temptation never truly disappears. What made this scam so insidious was the illusion of legitimacy. Lab coats, scientific jargon, pseudo-medical settings. It looked like a real clinic. It felt like progress. It smelled like trust. But it was a high-stakes gamble disguised as a breakthrough. In the end, these women didn't just lose their money. They lost the light. Case 3. The AIDS cure. That was actually a pyramid scheme. Deep in the Honduran jungle, nestled between misty hills and palm trees, a place called Usha Village offered what no hospital in the world could: the promise of curing AIDS, cancer, lupus, and virtually every chronic illness known to man. The man behind it all was Alfredo Bowman, better known as Dr. Sebi. He wasn't a doctor. He had no medical training. But he wore the title like armor, and people believed him. Dr. Sebi preached a simple doctrine. All disease came from mucus, and healing was only possible through a strict alkaline diet and a cocktail of herbs that he personally sold. Meat, dairy, alcohol, forbidden. Instead, followers consumed sea moss, teas, and capsules filled with powdered plants. He claimed these cleansed the body at a cellular level. To the desperate, his message was seductive. He was charismatic, spiritual, and rebellious. In 1988, he even placed an ad in the New York Times claiming to have cured AIDS. The FDA sued him for practicing medicine without a license. He won the case, not because he proved his cures worked, but because the judge ruled that testimonials were sufficient in that instance. That moment cemented his legend. Celebrities like Lisa Left Eye, Lopes from TLC, Michael Jackson, and later, Nipsey Hussle became vocal supporters. Usha Village became a pilgrimage site for the sick and the hopeful. But behind the bamboo huts and herbal baths, something darker brewed. Patients paid thousands for treatment packages, some selling belongings to afford the trip. Many abandoned antiretroviral therapies or chemotherapy, trusting instead in roots and restrictions. Some claimed success. Others deteriorated rapidly. Reports of deaths were quietly dismissed. There were no clinical trials, no studies, no follow-up. The entire model depended on word of mouth and emotional testimony. And the real business? It wasn't just healing. It was multi-level marketing. Dr. Sebi's products were sold globally, often through independent sellers who earned commissions. Testimonials turned into recruitment. Health turned into hustle. And suffering became currency. For every hopeful believer, there was a grieving family. One man recounted how his sister, diagnosed with stage 4 breast cancer, abandoned treatment after watching Sebi videos online. She died within months, convinced to the end that the herbs were simply detoxing her pain. What made the scam so dangerous was how it fused anti-establishment distrust with spiritual healing. For many in marginalized communities, traditional medicine had failed them. Dr. Sebi offered not just treatment, but identity, empowerment, and rebellion wrapped in a leaf. When Left Eye died in a car crash after visiting Usha village, whispers started. When others died under similar circumstances, the whispers turned into questions. But the myth of Dr. Sebi was too strong. He died in 2016 while in police custody. In Honduras, officially of pneumonia, conspiracy theories exploded. His name became a symbol in holistic circles. Documentaries were proposed. Celebrities mourned. And the herbs kept selling. What made this scam so twisted wasn't just the false hope. It was the way it turned faith into revenue. It told people to believe harder, detox deeper, spend more. In the end, it didn't matter whether Dr. Sebi believed his own lie, because thousands of others did. Case 4. The fake clinical trial that killed dozens. At first glance, Stemgenics looked like the future of medicine. Sleek branding, clinical-looking offices, and a promise so powerful it felt like a cheat code for human suffering. Revolutionary. Stem cell therapy for diseases like multiple sclerosis, Parkinson's, lupus, and even chronic pain. The company marketed itself as a research-driven institute, claiming to conduct clinical trials that patients could join for a fee. That fee, however, wasn't small. Most paid between $10,000 and $15,000 for participation, believing they were contributing to science and possibly healing themselves in the process. But behind the scenes, Stemgenics wasn't running trials. They were selling unapproved treatments under the false pretense of medical research. Patients weren't subjects in a study. They were paying customers in a well-dressed scam. The stem cells were derived from fat tissue and re-injected into the body, often without clear protocols or safety guarantees. Some patients reported no change. Others suffered infections, complications, or rapidly worsening symptoms. One woman with multiple sclerosis traveled across states and drained her savings to receive the treatment. Within weeks, she lost mobility in her legs and had to return to a wheelchair permanently. Her story wasn't rare, just rarely told. The clinic used glowing testimonials and aggressive online marketing to recruit more patients. They claimed success rates above 80%. The science behind those numbers? Non-existent. Instead, they curated selective quotes, removed negative reviews, and blocked questions in comment sections. Stemgenics used emotionally targeted ads to reach people on Facebook and Google. People who searched for phrases like cure for, lupus, or stem cell hope. Desperation became their targeting strategy. By the time the FDA intervened, dozens of people had been harmed. Some had died, not directly from the stem cells, but from delayed or abandoned traditional care. They believed they were part of the cutting edge. Instead, they were being cut off from real options. Class action lawsuits followed. Patients claimed fraud, negligence, and emotional trauma. In court documents, it was revealed that the company had fabricated data and misrepresented itself as a research institute. They never published a single peer-reviewed study. Even worse, some of the doctors involved weren't certified in the specialties they claimed. One was a former chiropractor turned stem cell specialist. Another had been sued multiple times for malpractice in other states. Families of patients spoke out. One man described how his father, suffering from Parkinson's, emptied his retirement fund to pay for the treatment. When it didn't work, the clinic offered another round, at a discount. He died a year later, broke and bitter. Stemgenics eventually declared bankruptcy. Its founders disappeared from public view, but many patients never recovered, physically or financially. And the scars they carried weren't just in their bodies, but in their trust. What made this scam so cruel was the way it exploited the language of science. It wore the costume of legitimacy, data, trials, breakthroughs. But under the surface, it was a pay-to-play scheme designed to profit off pain. They didn't just sell hope. They sold a lie wrapped in a lab coat. Case 5. The neurologist who invented a disease just to treat it. He was called a visionary, a pioneer, a medical genius ahead of his time. Dr. Paolo Macchiarini promised to change the world of organ transplants forever. At the height of his fame, he worked with prestigious institutions like the Karolinska Institute in Sweden, the very body that awards the Nobel Prize in medicine. His breakthrough? Artificial windpipes seeded with a patient's own stem cells, eliminating the need for donors and reducing rejection risks to near zero. It was a miracle. If only it had been real. Macchiarini's trachea transplants were experimental, but he portrayed them as safe and effective, even as patient after patient died under his care. He operated on people with non-terminal conditions, knowing the procedures had never been tested in proper clinical trials. Some of his patients were children. The results were catastrophic. Most recipients of his artificial tracheas died from complications, infections, implant rejection, sepsis. One patient, who initially walked into the hospital, spent months in intensive care before dying in agony. Another's trachea disintegrated inside their body. But the surgeries continued. Why? Because Macchiarini knew how to perform, in more ways than one. He dazzled the media. He was featured in glossy magazines, appeared on global news segments, and spoke at international medical conferences. He claimed to be engaged to a well-known journalist and convinced her they'd be married by the Pope himself. He said he was friends with the Obamas. None of it was true. He curated a persona. Part savior, part celebrity. Hospitals gave him funding. Institutions defended him. Even as evidence mounted, he kept receiving patients. When whistleblowers inside Karolinska tried to expose him, they were threatened, demoted, and silenced. One researcher said it felt like screaming into a vacuum while people died. He falsified data in scientific journals, misrepresented patient outcomes. In one report, he claimed a patient was alive and thriving when she had already died. The illusion began to collapse. In 2016, Karolinska finally launched an investigation. The media turned, and what had once been hailed as revolutionary medicine was now being called what it truly was: human experimentation. In 2022, Macchiarini was convicted of causing bodily harm and received a prison sentence. But many asked, was it enough? His procedures had led to at least 7 deaths. Families were shattered, institutions were disgraced, and faith in medical innovation was fractured. One of his patients, Yesim Keter, was just 24 when she underwent the transplant. She spent years in hospitals, enduring dozens of surgeries, infections, and endless pain before dying. Her father said she wanted to live. She trusted them. She trusted him. What made this case so horrifying wasn't just the experimentation. It was the charisma, the showmanship. Macchiarini didn't just sell a lie. He performed it. And people bought tickets to the illusion. He invented hope. He packaged it in a surgical gown. And when it failed, he moved on to the next. In the end, he didn't just play God. He played the audience. Case 6. The natural clinic that hid 76 deaths. Tucked away in the outskirts of Tijuana, Mexico, a healing center promised to cure what hospitals had already given up on. Cancer, ALS, late-stage diabetes. You name it. The clinic, known at various times as Clínicas Naturistas and later Cerebra Neurohealth, sold itself as a sanctuary for terminally ill patients. But behind the detox smoothies, infrared saunas, and herbal therapies, something far more sinister was happening. Patients would arrive from the United States, Canada, and Europe, desperate for a last chance. They were welcomed with open arms, calming music, and promises of total body cleansing. But once inside, they quickly learned that leaving wasn't encouraged. Some had their passports taken. Others were too weak to protest. The treatments were based on unproven methods. So vitamin infusions, coffee enemas, light therapy, plant-based cures. Some of them might have been harmless. Others, aggressively promoted as alternatives to chemotherapy or insulin, were dangerously inadequate. Patients began to deteriorate. One by one, they died. But no one knew, because the deaths weren't reported. The clinic quietly disposed of the bodies, in some cases cremated without consent or paperwork. In others, families were told their loved ones had simply gone home. The Mexican authorities began investigating only after an anonymous tip and a series of suspicious death certificates with vague causes like cardiac arrest or natural decline. By the time the full truth came to light, at least 76 patients had died under the clinic's care. Many were never autopsied. Some were buried in makeshift graves. And those responsible? They simply rebranded, changed names, reopened in a different building. The same treatments, the same promises, a new logo. Former employees described a culture of silence. Nurses were instructed not to ask questions. Some staff were allegedly unlicensed. The entire system was designed to avoid scrutiny while maximizing profit. The average patient stay cost upwards of $25,000, all paid in advance. The clinic used testimonials from survivors in online ads, many of whom were actors or staff members. They posted before and after photos, glowing reviews, and staged interviews. Meanwhile, real families were grieving quietly, some still, unaware of how, or even where, their loved ones had died. One woman flew her husband, a retired teacher with stage 4 pancreatic cancer, to the clinic after seeing an ad on Facebook. He died within days. She was told it was a healing crisis, and that his death was a sign that toxins were leaving his body. They offered her a discount on a package for her daughter. Another family, upon arriving to collect the remains of their father, discovered he had already been cremated without consent. His belongings discarded, his medical records wiped. The clinic simply said, "We're sorry for your loss," and handed them an urn. Mexican journalists who investigated the case were threatened. One former employee went missing after speaking to authorities. And yet, for every clinic shut down, another emerged, sometimes in the same neighborhood, under a different name, registered as a wellness retreat. What made this scam unbearable wasn't just the fraud. It was the calculated cruelty, the way suffering was turned into revenue, grief into upsell. These weren't patients. They were customers with expiration dates. And for some of them, even in death, there was no dignity. Because they didn't just vanish from hospital records. They vanished from the earth. They say medicine is the most noble profession, a covenant between knowledge and compassion. But what happens when that covenant is broken? These weren't just scams. They were betrayals of the deepest kind, manipulations that preyed, not on ignorance, but on faith. Faith in doctors, in science, in healing. And for some, that faith cost them everything. Hope, when sold as a product, can become a weapon. And in the wrong hands, even a hospital can turn into a hunting ground. So the next time someone offers you a miracle cure, remember this. Real medicine doesn't promise magic. It promises effort, process, risk, evidence, and above all, it promises accountability. If this video opened your eyes, hit that subscribe button and turn on notifications. We uncover the untold, the unsettling, and the stories most would rather bury. Share this with someone who still believes in asking questions. Because sometimes skepticism can save a life. And remember, not every monster hides in the shadows. Some wear scrubs, some hold scalpels, and some smile while they do it.